Have you ever been told that you have trouble making eye contact? That your eyes look distant, empty, or guarded? That people cannot read you because your gaze seems to hide rather than reveal? There is nothing wrong with you, and this is not a character flaw. This is your nervous system speaking through the only language it has left. The eyes are not just windows to the soul, they are windows to the nervous system. Research shows that the brain devotes about a quarter of its processing power to handling information from the eyes. They send about 10 million bits of data per second to the brain. They are constantly scanning, prioritizing two things above all else: danger and connection. For a child growing up in an unsafe environment, the eyes learn to do their job differently. They learn to look away. They learn to go blank. They learn to clench and withdraw, just like the rest of the body. This is not something you chose. This is something your nervous system did to protect you.
If that sentence lands somewhere deep inside you, please hit like and subscribe. Let's walk through this together. When a child feels afraid, their body clenches. Fists tighten, shoulders rise, knees pull up. They curl into a fetal position, creating a defensive shield. This is called clench and withdraw. It is the body's way of forming a boundary, a barrier against pain. But here's what most people do not realize. This clenching does not stop at the large muscles. It affects everything: the gut, the blood vessels, the diaphragm, and the eyes. Research shows that prolonged muscle contraction is one of the most common symptoms of chronic stress. When the muscles around the eyes clench, when the diaphragm at the base of the skull tightens, it constricts the nerves and blood vessels that serve the eyes. This leads to pain behind the eyes, tension headaches, migraines, and changes in vision. For trauma survivors, clench and withdraw is not a temporary response.
It becomes a default state. Your muscles stay tense, your diaphragm stays tight, your eyes stay locked in a pattern of protection that was designed for short-term danger, but has become a lifelong posture. This is why so many trauma survivors struggle with chronic headaches, jaw tension, eye strain, and difficulty relaxing their face. Your body is still bracing for impact. There is another way trauma affects the eyes, and it has to do with a tiny part of the brain called the reticular activating system, or RAS. The RAS acts as a filter. It decides what sensory information you need to be conscious of and what you can safely ignore. The hum of the refrigerator, the feel of your clothes on your skin, the flicker of fluorescent lights. Your brain filters these out because they are not threats. But trauma disrupts the function of the RAS. The filter breaks. Suddenly, all sensory input reaches the brain. Every sound, every light, every texture becomes overwhelming. This is why trauma survivors often develop sensory processing issues. They become hypersensitive to light, sound, smell, touch, and movement. For the eyes, this means that normal light levels can feel blinding. The pupil, which normally constricts and dilates smoothly in response to changing light, becomes dysregulated. Research from Swansea University found that people with PTSD showed exaggerated pupil responses to images, with less constriction to new images and greater dilation to scary ones. This is why some trauma survivors cannot drive at night. Oncoming headlights become overwhelming. The pupils do not track properly. The world becomes a blur of dazzle and confusion. This is not a vision problem, it is a nervous system problem. Now we come to the most profound way trauma affects the eyes, and it begins in infancy. A newborn cannot speak. They cannot explain what they need. Their survival depends entirely on their ability to connect with a safe caregiver, and the primary tool for that connection is the eyes. Scientists have discovered that signals pass back and forth between mother and child as fast as 1/300th of a second. In that instant, the child reads the state of the mother's nervous system. Is she present? Is she attuned? Is she regulated? Is she safe? This is why we call the eyes the windows of the soul. They reveal the state of the nervous system. Joy, fear, anger, worry, peace, deadness, disconnection. All of it is visible in the eyes. For a child in a complex trauma environment, looking into a parent's eyes is terrifying. They see distraction, anger, fear, or emptiness. They see that the parent is not safe to connect to. And because connection is necessary for survival, this creates panic. The child tries harder. They cry, they reach out, they make noise. But if the parent still does not connect, the child has two options. They become dysregulated, melting down in a panic. Or they shut down. They dissociate. They learn to look away. This is where the lifelong pattern begins. The child learns that eye contact is dangerous, that looking into someone's eyes might bring rejection, anger, or pain, so they stop looking. So what do the eyes of a trauma survivor look like? Some have trouble making or maintaining eye contact. They look away quickly, afraid of what they might see in another person's gaze, or afraid of what another person might see in theirs. Some have a distant, unavailable look. They are looking at you, but they are not there. Their eyes are unfocused, foggy, disconnected. Some have what is called a catatonic look, a blank stare, a zoning out that happens when the nervous system has retreated into a dissociative state. Some, however, go the opposite direction. They stare aggressively, studying your every movement, every micro-expression. This is hypervigilance through the eyes. They are not connecting. They are scanning for danger. And some have eyes that reveal the state of their nervous system in every glance. Fearful eyes, guarded eyes, angry eyes, darting eyes, squinting eyes, bug eyes, predatory eyes. All of them are messages. All of them are survival. Research confirms that the eyes of an adult who has gone through trauma reveal how safe they feel and how connected they feel. If they do not feel safe, their eyes will show it. If they do not feel connected, their eyes will show it. This is not a choice. It is a window into a nervous system that has been shaped by years of threat. So what can you do? Where do you begin? First, use your eyes as an early warning system. Pay attention to pain behind your eyes, tension in your jaw, squinting, headaches. These are signs that your nervous system is under too much stress. Listen to them. Second, if you have trouble identifying your own emotions, find someone you trust to look into your eyes. A safe person, a therapist, a close friend. They can see the state of your nervous system, even when you cannot name it. Third, begin to practice healthy eye contact, slowly, gently, with someone who feels safe. Do not push yourself. Start with short moments and expand over time. This is not about forcing yourself to be normal. It is about teaching your nervous system that eye contact can be safe. Fourth, practice unfocusing your eyes. Let your gaze go soft. Let your eyes relax. Research shows that this simple act can help calm the sympathetic nervous system and shift you into parasympathetic rest. Finally, engage in somatic therapies. Yoga, breathing exercises, walking in nature, pet therapy, music therapy. These practices help shift your nervous system out of clench and withdraw and into a state of safety and connection. And when your nervous system heals, your eyes will heal with it. Here is what we want you to hear, really hear. Your eyes are not broken. They are not lying. They are telling the story that your mouth cannot speak. They are revealing the state of a nervous system that has been doing its best to keep you alive. The avoidance, the blankness, the hypervigilance, the tension. These were not choices, they were adaptations. They kept you safe when you had no other tools. But now, slowly, gently, with compassion, you can teach your eyes a new way. You can teach them that safety is possible, that connection can be safe, that looking into another person's eyes does not have to mean getting hurt. You are not your trauma, and your eyes are not your shame. They are the windows to a nervous system that is ready to heal. If you are ready to go deeper into how complex trauma shapes your life, we have videos that walk you through the next steps. Signs and relationship patterns of dating a narcissist, and how complex trauma shapes your life. We will link them in the description and in the comments below. Drop a comment if this resonated. Share what came up for you. What have your eyes been trying to tell you? And if you have not already, please subscribe for more compassionate, trauma-informed content.